ml feeding. It's all patient specific, whether they get them all night long and then they don't have any during the day, or whether they get like a bolus per feeding, like I get a breakfast, lunch, and dinner sort of thing. It all is patient specific, so I can't really tell you how it's going to be on every patient. Okay, but say this patient has this feeding running and I've got to come and give some medications. It's extremely simple. I would leave it running as I prepare my meds, so I'll do that now, and then I'll show you how I would give those meds. So I have my order here. Let me get my stuff together. This is just randomly set up, so hopefully we got all the supplies we need here. Okay, so I'm outside of the patient's room, and as you did in PO Med check off, or you're going to do, we start by comparing our order to our MAR every time. Okay, so my admission order has a bunch of orders, and I'm going to navigate down here to the med. So it looks like I'm giving 1 milligram of folic acid per peg tube daily at 9 o'clock, and I'm giving a multivitamin 30 mLs per peg tube daily at 9 o'clock. These are both for Mr. John Smith, and their birthday is the same, 1/25/46, same here and here. And okay, so it looks like I got what I need. The orders match the MAR, so I'm going to put that away. In order to give folic acid safely, there's nothing I have to check, and same goes for a multivitamin. So really I don't have to look at labs or vital signs or anything. So I'm looking at Mr. John Smith's drawer. I'm going to pull out multivitamin, and I'm going to pull out folic acid. So it looks like folic acid comes in a tablet, and it is crushable, and multivite comes in a liquid, so it's already how it needs to be. So to get started, because I'm going to take them out of their packaging, I'm going to wash my hands and put on some gloves. And let's act as if I'm in the med room and I got everything I need here. This is my how I'm going to crush my med. Okay, so since I'm taking it out of its original package, I do have to label my cup. This is what I meant by having supply. So this is folic acid, 1 milligram, JS room 2. Okay, so I'm going to, so that was my first check, was pulling them out of the drawer. Now I'm on my second check. I'm going to get 1 in here, so 1 milligram of folic acid is worth 1 tablet, so I got my second check there. It's not expired, it's for John Smith, and it's due now. The next medication I'm going to give is the multivitamin. Because this is a liquid, I need to stand at eye level. Let me write on my cup for that one as well. Multivite, it's going to be 30 milliliters for JSN room 2, I think. Okay, so I'm going to go ahead and open this medication. I'm going to put the label in my hand so I pour it. I don't, pour it onto the label and accidentally mess up the label. I got to get eye level with it, and I'm going to get 30 mLs in here. All right. So that was my second check. I got both of those like I need them. Before I can administer the tablet, though, I've got to crush it. So I'm going to grab a sleeve from my Silent Night. We call the crusher a Silent Night. I'm going to put it in the sleeve. Can y'all all see? No. I'm going to, so I have the pill in the sleeve. I'm going to crush it up. Okay. Then I'm going to slowly open the sleeve and put it back into my labeled cup for that med. Trying to get all the residue out of there. Okay, and then I would throw this away in my trash without losing sight of my. Okay, so now this one actually, I need an assistant. I need some water. Water. Give me some water, please. I would already have had this out of the sink in the classroom.
There's those things in here.
So you don't have to put any water in the bag that you just crushed to make sure you get all the vitamins?
I'm about to put it into the cup with the med that's crushed.
I mean the sleeve.
Like rinse out the sleeve.
Oh, no.
Rinse the sleeve out?
No.
Okay. Okay. No, I'm saying like for the residue of.
Yeah, to make sure you get the whole thing.
Right. Okay.
Okay, I'm gonna take note of how much intake I'm about to give the patient. So I'm only gonna get a little bit of liquid in here. Let's say I got, this is being very precise, got 10. I'm gonna put a little bit, like 10 to 15 mLs with each med that's crushed. Typically not supposed to use the tip of this if I'm going to give a bunch of different meds, because if they're not compatible, that means I'm contaminating each med. But because I'm only giving this one with it and it is compatible with the multivitamin, I'm utilizing the syringe to stir it. And you see now it's stirred very well, but by the time I get to the room, it could settle on the bottom, so I may need to do that again. If I did not want to use this and I wanted to do a better way, I could use like one of those sponge or toothettes, the tip, the back side of it or something like that to stir it up. A straw, I don't know, something simple. Okay, so now I'm done with my second check. I've got my 1 milligram of folic acid crushed up in here with 10 mLs of water, my 30 mLs of multivitamin for Mr. John Smith, and we're going into room 2. So now I'm at the door. I've got room 2, Mr. John Smith. Let me take off my gloves and clean my hands again. And I'm going to go to this side since that's where that pump is. Hi, Mr. John Smith. I'm here to give you some medications through your PEG tube. I'm going to clean my hands and get some gloves on, but in the meantime, can I ask if you can give me your name and date of birth? Mr. John Smith. Mr. John Smith. Okay, that's who you are. And your birthday is 1/25/46. 1/25/46. That's accurate. Do you have any allergies? Not that you know of? Oh, great. Okay. So we're gonna proceed. Let me go ahead, since I'm at the bedside, I'm gonna do my third check. I've got folic acid 1 milligram, folic acid 1 milligram, mixed in 10 mLs of water, and that's for you, Mr. John Smith. And then I have a multivitamin, and that is 30 mLs, and that's for you again, Mr. John Smith, and it's both going the route of your PEG tube. So for that, I do need to stop your feeding, so I'm just going to hit pause on those. Some of them also have these stopcocks, so you can see where the arrows go and it's open so the feeding can go forward. But anytime that I disconnect the feeding or I'm going to open the PEG tube, I need to turn it off toward the patient. If he coughs, sneezes, turns the wrong way, feeding or formula or stomach contents comes out of there, okay? So I'm going to turn it off to him, and I'm going to take his feeding off this away. Again, consider this like a fork or a spoon. We don't want to drag it on the floor in their peri area. I typically have the cap like taped onto here to where I could just like stick it in there or something of that nature. If not, and you want to make sure you keep it clean, you could use a clean glove or however you want to make sure that's not going to fall on the floor and get contaminated, okay? It is going to alarm. I think this one only pauses for 2 seconds or 2 minutes, which is fine. I could shut it off completely, but for now I'll just leave it that way. So the first thing I have to do is I'm going to place my towel under here in case we have any seepage. I'm going to look at your site to make sure it looks clean around the PEG tube. I'm also going to identify by the chart says, okay, we should be at a 19 or whatever measurement the doctor said, how long it hangs out, so to speak. And the last thing I have to do, since a patient is getting a continuous feeding, we check a number called a residual. Residual is sometimes people who have feedings, they're not going to digest it immediately, right? So they might be having a little feeding still in their stomach. The thing we want to be conscientious of is obviously they have a faulty, I don't want to say faulty, but they have an issue with their GI tract. Why else would they have the PEG tube, right? So I don't know what that issue necessarily would be, but sometimes they don't digest. So would we want to give all these meds to someone who's not digesting their food either? No, because then they're not getting the medicine. So we check a residual to make sure that they don't have too much feeding. This is going to be per facility policy, how much they'll allow you to have a residual and still administer feedings or food or meds. I always kind of go off my own little judgment before I'll call the doctor. If they have double their hourly rate of feeding still of residual. So he's set at 50 mLs an hour. So if I get 100, I'm gonna call the doctor and just see what he wants me to do. Some facilities are like, if you don't get till 500, then we'll stop feedings or something like that. So for now, just for checkoff reasons, I want you to verbalize that I'm gonna check a residual. Excuse me, I'm not gonna get one, right? I'm gonna have resistance because I never opened him back up. So I'm gonna open the stopcock to be open, and I should be able to pull back on the plunger. Sometimes you'll get resistance, and see how much I have residual? Do you see what I have here? Okay, so I'm gonna turn it back off. If I were to keep getting residual, I would turn it off, take it out, and keep measuring. But the really important thing is you don't want to instill all that air back into their stomach, and you also always have to give residual back to the patient, because if not, you're pulling off like vital nutrients, right? So I'm gonna say I have a residual of 2 mLs. I'm gonna give this right back to the patient because that's safe in regards to continue with my med pass. Okay, so I got a 2 ml residual. A patient seems to be digesting fine. There's no issues with how far the tube's out. It's at a 19, which is what surgically they put it in as. And so now I'm ready to give you these medications, sir. So what I'm gonna first do is utilize this table to get closer to you. I'm gonna just keep pausing that, or I could just turn it off. This is when I now need to take the plunger out. Okay, so I've checked residual. I now do not need to use the plunger because we give feedings by gravity. Okay, and meds by gravity. So with that, I think I just stripped that out. So we're gonna start, sir, by inserting this large bore syringe, and I'm going to open it up once I get some water in here. So this takes a lot of moving. Okay, so I'm gonna start by just flushing your tube with 30 mLs. This is important in the case that I wanna make sure the tube's flowing well before I instill meds in there. And also it has a lot of feeding still in there as well, right? So I've got the stopcock on this one. Some patients don't have a stopcock, and I've got to use like my pinky finger to keep clamping, going up and down as I clamp. Okay, so it's just by habit that I still do my pinky like that. But anyhow, I don't have to. I can just open the stopcock, raise it up with gravity, and as it comes down, I don't want him to get air, so I'm going to come down with gravity, turn my stopcock off so he doesn't get air. So I got him 30 mLs of flush. And now I'm gonna give you your multivitamin. That's your first medication. And this is just to replenish any vitamin lost and maybe to help with some wound healing. And so now I'm gonna open it back up and give you that medication, coming down with gravity, and I can use my stopcock. Now I gotta flush a little bit between meds. Let's do about 10 to 15 mLs. Open my stopcock, raise it up, come down with gravity. And now see how this one kind of settled a little bit? So I could use, I have my plunger right here. So I could use my syringe, or that tooth that I talked about would probably be even better. A straw to give you this last med, which is now your folic acid, also a supplement for you. And then a 10 to 15 mLs flush after that. And then I'm gonna come down. Right after the last flush, we're done with your meds. So I'm going to reconnect your feeding now. Open your stopcock back up and hit run, or set it back up if it was off, and let it keep running. Making sure it runs, it doesn't alarm on me, everything's flowing freely, and it looks to be working. Alrighty, sir, that's all I have for you today. Do you need anything else? And then he's done, okay?